I chose medicine because I wanted to find a career that gave me the ability to have the most direct impact on a person's life in a positive manner. I'm Evander Fogle. I'm a board-certified orthopedic surgeon, and I specialize in sports medicine injuries and problems of the knee and the shoulder. There was a famous surgeon who once said that the first step in caring for a patient is to care about the patient. And so I find it far more helpful to hear what a person has to say rather than seeing their MRI or X-ray, although those are also important. But I feel like hearing what the person is saying helps me tailor the treatment to that person's specific needs. The knee and the shoulder are frequently injured in sports, and I enjoy taking care of people who do things that are active. The knee and the shoulder are also particularly complicated joints. The knee because it's one of the most important joints for walking, and the shoulder because it has more range of motion than any other joint, and therefore there is a complex interplay in the treatment of shoulder injuries. I originally wanted to be an engineer because I like to fix things and I like to build things and design things. When I went to college, I realized that I would rather do something that would have a more direct impact on people, and I felt that medicine was my true calling. Orthopedics was an obvious mix of taking care of people and using engineering type principles to solve problems. When I finished my residency in orthopedic surgery, I served as a military orthopedic surgeon, first in Guantanamo Bay, Cuba for a year, and then I moved to Camp Pendleton where I took care of injured Marines. My last tour of duty was at the Naval Trauma Training Center in Los Angeles, where I was an instructor for injuries that would be sustained in a combat situation, teaching medical personnel who were about to go overseas about how to evaluate and manage those kinds of injuries. I think my military training gives me a unique perspective because it was both sports medicine focused and trauma focused, and many sports medicine injuries involve a traumatic injury, which gives me some special preparation to take care of people with those types of injuries and issues. When a patient comes in and is very concerned about their injury, I will spend extra time with that person to help them understand that it's all going to be okay, and whether surgical or non-surgical treatment is required, most injuries get better. The vast majority of patients that I encounter do not require surgery to get back on their feet and back to their levels of activity that they desire. I would estimate 10 to 15% of patients actually end up requiring surgery, and that's not a large amount. In the last several years, we've developed the ability to treat more and more patients with minimally invasive surgery, such as arthroscopic treatment of the shoulder or the knee. My ideal patient would be a recreational athlete, such as myself, who injured themselves in some way. That person would be somebody who would be as motivated to get better as I am motivated to help them get better. I love to come to work because I'm always interested to see who I'm going to get to meet that has some new impact on my life. I'm also gratified by being able to bring patients from a situation that they don't want to be in to a feeling of success, and there's nothing more satisfying than knowing you did a good job and maybe you helped somebody.